Let's say you have a sexual health concern. I know, sure, not you. You're asking for a friend. I get that. It's okay, I'm a doctor. People come to my office for all kinds of reasons. Sometimes it's something easy to talk about, and other times, like when it's a sexual health concern, not so much. But it's a fact. We all have sexual health concerns from time to time, and when that's you, who are you going to call? A doctor. Maybe, of course, eventually. Not right away. People tend to call their doctors after it's become clear that Googling frantically and freaking out is neither healthy nor productive. That's the way it works, right? We doctors have the facts. You can talk to us. You can ask us anything. Wondering if that pain is indigestion or a heart attack? Call a doctor. Is it pink eye? Ask a doctor. That weird-looking rash? A doctor. When it comes to health, we doctors have the answers. That's like our whole job. But what happens if you have a sexual health concern and go to your doctor, the person with whom you're supposed to share everything, no matter how gross or embarrassing, the person with whom you trust and confide in completely, and it turns out they, the doctor, was never taught sexual health education in medical school or residency? If not in medical school, then where are the doctors getting this information? What if your doctor went to school abroad in a country that did not regard sexual health as an important part of health? What if it's worse than that? What if your doctor is more uncomfortable discussing the topic than you are? It sounds like it couldn't happen, but it does. It happens all the time. You might think that sexual health education is a crucial part of a doctor's medical training, but that is almost never the case. At least it wasn't for me, and I'm an obstetrician gynecologist. This was something that became very clear to me on my wedding day. There were months of preparation. The food ordered, the dress bought, the invite sent out. It was a big deal. But it wasn't until the day itself, my actual wedding day, that my mother sat me down and instead of having the talk, assumed she didn't need to because I had gone to medical school and had just completed 4 years of training in obstetrics and gynecology. Now, I know that you know the talk I'm talking about, but just in case you don't, it's what to expect when you expect to have sex on your wedding night. No, I told my mother, I need the talk. We hadn't had it before, and I definitely didn't get it in medical school or residency. Now, some of you may be thinking that this has something to do with my culture and faith. I'm a Muslim woman. That's right, I'm a female Muslim gynecologist advocating for sexual health to be taught in our medical schools and residency. To some, that may sound like a contradiction in terms. But why? Because as many of you are likely aware, our society holds many misconceptions about Islam. Among them, that it's a religion that represses women and stifles conversations about sexual health. Nothing could be further from the truth. Islam is a very sex-positive religion, and women have sexual rights in Islam. Another misconception is that going to medical school is all about having a frank, open, and informed discussion about sexual health. The simple fact is, our medical schools don't adequately teach about sexual health if they do so at all. One study found that despite the frequency with which physicians find themselves having conversations about sexual health, only 50% of the medical schools in the United States required any formal training in sexual health. More than 20.6% of all medical students stated they received no training at all in sexual health. And despite the fact that most medical students have a desire to help their patients with sexual health issues, only residents in relevant fields, say urology, for example, felt confident in their ability to assist patients with sexual health concerns or that they had even been adequately trained. On the other hand, most gynecologists do not receive any training in sexual health concerns. Why this glaring gap in the curriculum? Well, one thing we can say for certain is that no one is questioning how crucial this information is. In fact, the World Health Organization states that sexual health support is a fundamental human right. There's also no question about the damage the absence of sexual health support and resources causes. It can lead to misinformation, neglect of symptoms, and progression of diseases that could have been addressed and treated much earlier. Comprehensive sexual education leads to better patient outcomes, improved mental health, improvement in doctor-patient relationships, and better outcomes overall. Let me put it like this. We all need to have the talk. And for goodness sake, let's not forget the medical students. How do we transform this narrative? How does this change start? It's a big question, and it can seem daunting. The fact is that there are simply not enough wise Muslim women, like my mother, to go around to all the medical schools in the country. We start this change by creating a more sex-positive environment. Sex positivity is not about encouraging promiscuity, as some people continue to believe, but rather about acknowledging, understanding, and respecting the sexual health behaviors of ourselves and others. It's understanding that sexual health is part of a person's overall health and behooves us as physicians to be able to help our patients when they turn to us. Being able to have a frank, open, and informed discussion about sexual health begins by being intentional and making it a priority at every level of our healthcare sphere. This is a matter of dignity and respect. It's also a matter of public health. We know that there are some sexual health diseases that are life-threatening. The sexual health education of doctors can quite literally save lives. Next, we doctors need to change our mindset. Our discomfort surrounding sexual health discussions and prevailing sex negativity are problems that permeate our healthcare sphere. These habits of mind are our deeply held beliefs and attitudes generated by our experiences and then colored and molded by our feelings and individual point of view. Whether conscious or unconscious, there exists a bias that prevents sexual health education from being the priority that we know it needs to be. As with any bias, addressing it begins by naming it. So long as we pretend it doesn't exist, it's going to continue. Finally, we need to do better, a lot better, when it comes to educating ourselves and our students about the complex functions of the human body. Most doctors are familiar with the female reproductive organs and external genitalia known as the vulva, but unaware of the sophisticated functions that they're capable of. Our bodies are far more than vehicles of biological utility. To truly understand the female anatomy, beyond its reproductive capabilities, we must learn to respect and understand its capacity for complexity, pleasure, and healing. There's a saying in my Islamic tradition that the seeking of knowledge is an obligation upon every Muslim, be it man or woman. So let us seek and share this knowledge and acknowledge that our goal should be to not only cultivate an environment of sex positivity, but to make it a reality. We can not only say that we are sex positive, we must act on it. We must teach our physicians to not only be comfortable having discussions about sex, but rather to make them be advocates for healthy, positive sexual experiences for their patients. All of us need to name the bias against sexual health education when we see it amongst ourselves and in our institutions. This journey of transformation begins with a single step, and this conversation here today is a step in the right direction. So go ahead. The next time you see your doctor, make sure to voice your sexual health concerns for both you and your friend.